So I guess what are the RACGP exams or written exams looking at? As I already said, it's a breadth of knowledge. They want to cover a wide range of curriculum areas, and we'll talk a little bit about that later on in the presentation. But it's not just about sort of clinical knowledge, it's also about how well you know your medico-legal, how well you know your ethical issues, and how well you can communicate these. The context is, an Australian general practice. Could be questions come from both urban and rural practices. And they're not expecting you to know something that a GP who's been practicing for 20 years knows. They're expecting you to be the level of a newly fellow GP that's practicing independently. So the questions are aimed to be answered so that if you're sitting alone in a room with a patient with no supervision, that you'll do the safe thing. And I guess the other big thing is in the AKT, they're testing applied knowledge other than knowledge that's rote learnt. And in the KFP exam, they're looking for clinical reasoning. And we'll talk through both of them a little bit more. So first up, the AKT, it's the applied knowledge test. It's 150 essentially multiple choice or extended match questions. And you're given 4 hours to sit the exam. So they say that the exam should be able to be completed in 3 hours, but rather than making people apply for special consideration or those who have English as a second language or problems with dyslexia, etc., they've just given everybody an extra hour to sit the exam. So that's why you're given 4 hours. You're not allowed to leave in the exam, you just have to sit there until it's finished, and you don't have to submit your exam until the time is up, so you have plenty of time to review your answers if you want. Both the AKT and the KFP now are computer-based, and as I said, it's a mix of both multiple choice or single best answer and the modified extended match questions, which usually have about 10 to 15 answers where you choose one of them. So as I mentioned before, the AKT is really looking at applied knowledge rather than knowledge that's rote learnt. And that's how they're differentiating between medical student level and general practice level. So I've just got an example here that I think shows nicely the difference between applied knowledge and rote learnt knowledge. So Jim is a 65-year-old male. He's a regular patient of your practice. He's recently developed a regular morning cough and has noticed he needs to rest after walking 1 kilometre as he feels out of breath. Quit smoking 5 years ago after smoking 20 cigarettes per day, for 40 years. His spirometry shows an FEV1 over FVC of less than 0.7 and an FEV1 of 70% of the predicted for his age. This is post-bronchodilated. This is consistent with mild COPD. What would the most appropriate initial treatment for Jim be? Sorry, a few spelling errors there. So A, salbutamol, B, indactorol or another LABA, tiotropium, E, the umeclinidium or vinelanterol, so the LAMA-LABA combination, or E, fluticasone. No need to actually answer the question. So basically that is a question where they tell you a bit of a clinical scenario, they give you a diagnosis, and then they ask you what the treatment is. That's a question that anyone at any level could answer just by knowing what the treatment is for mild COPD. You don't actually need any of that clinical history. You don't need the age, you don't need the gender. They literally could ask, what is the first line treatment for mild COPD? The rest of it's just a bit of preamble. However, in an AKT, you could have a question similar, but what they would do is ask the same stem, so 65-year-old male, new morning cough, shortness of breath after walking 1 kilometre, he's an ex-smoker of sort of 40 pack years, and get you to look at the spirometry. So this is just a spirometry I sort of pulled from patient / made up. And on there, if you look, you can see that his predicted FEV1 is only 65% with no change post-bronchodilator, and his ratio of FEV1 to FVC is only 63% of the baseline with minimal change post-bronchodilator. So from that, you have to conclude that he's got mild COPD, so the FEV1 of 60 to 80% is the mild category, and the diagnosis is from the FEV1 to FVC being less than 70%. And so from that, then you have to say what is the most appropriate initial treatment. So the applied knowledge aspect is diagnosing that as mild COPD and then knowing what the drug treatment is. So the other thing about the AKT, is that each of the questions asked will have a lead-in statement. So as you noticed with that one, it said, what would be the most appropriate initial treatment for gin? And that's the way most of the AKT questions are asked. It'll be, what is the most appropriate investigation or the most important diagnosis? So I guess the diagnosis not to miss versus the most likely diagnosis. And then, as I used, what is the most appropriate initial treatment? And that lead-in statement is probably where most people go wrong in the AKT, because if you had a question that asked about, what is the differential diagnosis for someone who's immigrated from Southeast Asia, presents with several years history of cough productive of sputum, and is a little bit blood tinged with clubbing, for example. I think that's given on there, one of the ESO modules. And they talk about the most likely diagnosis being something along the lines of bronchiectasis, but the most important diagnosis not to miss in someone with bloodstained sputum with clubbing or a long history of a cough may be something like tuberculosis or a cancer of the lung. And that's where you can definitely go wrong in misreading that lead-in statement because the question can change quite dramatically. And also it does mean that you have to incorporate in the most likely diagnosis, you have to really look at your demographics. So is this a young person? Is this an old person? Are they male and female? Whereas in the most important diagnosis, that may be different. And then the age-old question is, that always went around in my medical school, at least, it was that C was always the best option to choose in a multiple choice exam. Unfortunately, in the AKT, all the answers are listed alphabetically. So C is not statistically going to be correct more of the time. But it is important to note that there's no negative marking, so it's best to answer every single question. And the other thing is that I would recommend that all of you go through the ESO modules online or familiarise yourself with the RACGP videos that are available, which just give you snapshots of how to use the online platform for the exams. And one of the things that you can do in both AKT and KFP is flag questions that you want to follow up later. But in doing that, you've got to remember to always tick one of the boxes. So if you've got a question you think the answer's C, just select it. But if you're not sure, you flag it and come back to it later. If you don't select any answer and run out of time, you won't get it. You haven't got the opportunity to at least get a 1 in 5 chance of getting it right. And I have heard of a few people who didn't realise that was the case. And I guess the other important thing when going through the online system is making sure that you've had a practice at it. So RACGP do release a practice exam, which you can do a few weeks before the actual exam. And although I don't think it's that predictive of how you'll go in the actual exam, I think it does give you a really good idea of how to use the online platform that they run the exams through.